Horizon TV, the beacon for the nation.
Assalamu alaikum wa rahmatullahi wa barakatuh. Welcome, this is Stay Healthy. It's another Tuesday morning. Hope you're doing fine where you're watching us from. My name is Abdulrahman Gaddafi, and today our topic of discussion is migraine and interventional headache. Most of people experience this type of illness, and today we are going to get solution. The doctor today is Dr. Mahendra S. Chouhan. Is going to tell us more about the topic of discussion today. And if you have any questions, you're free to ask, free to call us, so that at least you can ask your question and get direct feedback from our doctor. Remember, the program has brought to you by Nairobi Neurocare. Good morning, Dr. Hari.
How are you?
How are you?
Thank you.
Doing great?
I'm good, yeah.
Welcome. Today our topic of discussion is migraine and interventional headache. You know, most of people experience this type of illness. Maybe what are some of the misconceptions that most people have about this type of illness?
Not only headache is something which is experienced by almost everyone on the planet.
Yes.
Yeah. At least once in a lifetime they have such severe headache that they don't want to go to work, they don't want to perform work at home,
Yes.
they just want to be in bed. So that means almost 100% of population is suffering headache at some point of time. As the urbanization is increasing, the tensions are increasing, the population is increasing, competition is increasing. This is putting everything under stress, everyone's mind is under stress. Okay. Because of that, the migraines, the headaches, they are becoming more and more worse. Much more days of disability is claimed by headache. One of the worst examples that I have is the lady who was working in Kuwait, this highly paying job, and she had so much of headache that she was not able to go on most of the days, so she was sacked from there. When she came back here in Kenya, she was actually, then she couldn't make up well with the husband because of the constant headaches, and the husband divorced.
No.
And then when she saw that now because of headache, she is not able to maintain a job, maintain her family, is when she actually sold her house and went to USA and UK at different centers.
For treatment?
For treatment.
Okay.
So she actually broke because of headache. She became broke because of headache. Her relationship broke, her job, she was jobless. Even at home, most of the days when she was having headache, she would just weep, holding her headache because no one was able to give her relief. She didn't want her kids to go inside, and it became a traumatic experience for the whole family, and for good 24 years. And then we, with our own unique concepts of headache and its understanding and its intervention that we do, we treated her for the first time for 8 straight months. She did not have significant headaches. Even if she had some mild headaches, she was able to control them with ordinary paracetamol. So not only that the people in general have got headache misconceptions, but even so many in the medical fraternity, there is a very poor understanding of from where the headache is coming.
Okay.
So I would like to take our viewers towards my presentation, which I have created.
Yes,
so that
before you take them there,
a little more,
you know, Dr. Ari, most of people, they have misconception of whereby whenever you receive any pain from your head, you just have to take the painkillers, and when you feel relief, that's when you feel like you're fine. Do you advise for that?
No, I strongly do not advise it unless it's just an occasional headache. And it goes well with the painkiller. To begin with is okay. But if the headache attacks are repeated, if you are feeling them coming frequently nowadays, then you must go to a nearby neurosurgeon or a neurologist and at least get your CT scan done, particularly in people who are 35 plus and who are having headaches in the recent onset.
Yes.
I would always recommend them, they check their eyes, they check their brain through a scan, so that we do not miss out on a critical illness which can actually claim someone's life, because we have several examples where people have ignored a simple advice of doing a CT scan, and they found dead in casualty. So I would say
You'll
that
not
you
advise
should,
that.
yeah.
And maybe try to define this so that at least the viewers back from home, they can understand it well. Maybe what is the difference between a typical headache and maybe a migraine? So that at least someone can be like, which type of medication can I go to?
I have a problem with even the name migraine, because the definition of migraine is headache, where all the investigations are normal.
Okay.
Yeah, it has got certain pattern. It can be on one half or the other half. It has got certain patterns, whether it is frontal. So they have been named differently as cluster headaches and migraine headaches. But now I think headaches differently. So which I will explain with my presentation, is that why these are different. Because once you say that we do not know the cause from where the headache is coming, then what are you going to treat? And if you don't know what are you going to treat, your treatment will always be inefficient. So what we pondered upon about 2 years back, we started doing interventional headache management, and now we have treated successfully, or very successfully, 150 plus cases, where we all done different types of interventions, which I will describe in my presentation. Based on that, I have been recently invited in one of the biggest institutions of India in a national pain conference on how we are doing it in Kenya, because practically no one is doing in India. So these are some very unique approaches that we have seen, and we can proudly say that we are relieving and we are making difference in so many people's life with as simple problem as headache, which has been ignored by higher medical fraternity because it is considered as a general practitioner's job.
Okay.
Yeah.
So I think we can dive into your presentation so that at least we can understand the difference between the two, the typical and maybe the migraine. But Dr. has said all is headache. Okay.
I'll rename it.
Yes.
Yeah.
So
if I can have myself and the presentation
right
on
away.
the TV, then definitely we can
describe it more.
Into, yeah.
Yes. Yes, Dr. You can continue.
So, interventional headache management is something which is very new on the block. Practically no one is doing this kind of practice. It is usually considered that the headache, it comes from inside the brain. Okay, it comes from inside the brain, and maybe it comes from the blood vessels, it comes from the membranes of the brain, and so basically it was a very vague idea of where it is coming, and so the pharmacology was decided on that way. So someone is giving some medicine, A, B or C medicine, but these were having very unpredictable outcome with the patient. So not as late as 2014, which is not very late, there's some doctors who did the examination, electron microscope examination of the nerves under the scalp, that are these the ones which are aching, right? And they found that these nerves are abnormal. They had abnormal conduction. So these are the nerves under the scalp which are causing this pain. So it was scientifically proven for the first time, and that's why it went that way. And then we found out that there are certain trigger points from where pain comes almost always. Yeah. So these trigger points, they are in the front, in the forehead, in the eyes, in the nose, on the side. So now there were a lot of studies done on the dead bodies in some American and European countries, where there was a clear-cut history of lifetime headache, who have died. Their dead bodies were dissected. Their scalp were dissected. And then we started finding out that what are the problems. So it is a very evidence-based medicine. So we found out that, like, this is the dissection. So if you see here, there's a huge network of nerves under the scalp, which connected. So face and the entire scalp and neck, they are all interconnected. So if you see all these yellow thread-like nerves, these are all nerves. They're all interconnected. So if pain starts from one point, then it goes everywhere. Okay, it's like once a traffic jam happens on a main road, the collaterals open, people start going out from the small roads, and so all the connections are filled. So that means one problem can spread if there is an interconnection. There are collaterals. So that's how the theory was, there was a theory that once there is a trigger point, it is irritating one nerve, then the nerve starts paining, which we call as neuralgias. And then from there, if it is chronic, it starts spreading to other parts.
Okay.
Now I also show you this diagram where I want to show that there is a nerve which is called as a trigeminal nerve, which supplies the head, forehead, front of the head, the forehead, the entire face.
Okay.
Okay. And the inside of the nose, inside of the mouth, everything.
Okay, Daktari, I think we're going to hold it there. We're going to take a short break when we get right back, so that at least our viewers can understand it well as you elaborate it, and also on how we can manage it. That is going to be our next question when we get right back here. Stay tuned at Horizon TV.
Okay.
Horizon TV, the beacon for the nation.
What makes the exchange of goods and services interesting?
From the word Fayaz Bakers, anyone can know what we are doing. So, but mostly we are known for our cookies and cakes.
What makes human beings seek for needs and wants?
When the customer takes the trip, we make sure that we call them and we say, how was the trip? And they'll come, oh, the trip was good, it was nice, okay, we've rewarded you with this.
What makes the young venture into business?
Mamangu alikuwa anapenda kufanya sadaka and stuff. Alikuwa anataka kufanya vishete, so I told her, let me make vishete. So akanipatia kila kitu, I did it, and they turned out better than hers.
But what really motivates their actions?
I was telling brother, it's difficult, ngangana usichoke, unaweza.
Join us on Show Me the Market as we seek to understand the market of different businesses for young entrepreneurs, only on Horizon TV.
Quote of the day. Imam Muhammad bin Idris al-Shafi'i said, "To admonish your brother in private is to advise him and improve him, but to admonish him publicly is to disgrace him and shame him."
أعوذ بالله من الشيطان الرجيم. يا أيها الذين آمنوا إذا نودي للصلاة من يوم الجمعة فاسعوا إلى ذكر الله وذروا البيع ذلكم خير لكم إن كنتم تعلمون.
Enyi mlioamini, munapoitwa kuhudhuria swala ya Ijumaa, fanyeni haraka kuikimbilia, muache biashara zenu, hilo ni bora ikiwa mwelewa.
Isikilizeni kwa umakinifu khutba ya Ijumaa
ili uzidi kujenga imani yako na kupata faida nyingi ya siku hii.
Coming to you every Friday from Jamia Mosque, Nairobi.
Live on Horizon TV.
Assalamu alaikum wa rahmatullahi wa barakatuh. Welcome back. This is Stay Healthy. This is Horizon TV. Today our topic of discussion, it's about headache and typically all known as migraine. Most of people have different type of migraine, and Daktari has tried to explain and using some of the diagrams that is going to pop up on your screen, so that at least you can understand the difference of typical migraine, the typical headache and migraine itself. Daktari, we can continue.
Yeah. So I would again go back to my presentation.
Yes.
If we can share it with the screen.
Mm-hmm.
So, and this is a very basic understanding. This explains the headache in its most comprehensive way.
Mm-hmm.
So I would like our technical team to project the
presentation is there.
Yeah.
Yes.
It's there, yeah?
Yeah.
So if we see that the head is supplied by a nerve which is called as a trigeminal nerve, and then there are neck nerves. First three nerves of the neck we call as cervical nerves, C1, C2 and C3. They are supplying the back part of the head, so this part. Okay, now so the front part and the back part have got a different nerve supply, but they get connected in the lower spine. So whenever there is a severe pain on the face, maybe left side, right side,
Yes.
eventually starts showing up on the back of the head or in the neck area. And if people have got cervical spine problems like cervical spondylosis, even yesterday I had one patient like this, particularly old age patients, 55, 60, 65 plus. Maybe they have some nutritional deficiencies as well. Now if you press these trigger points which I had shown earlier, the whole body starts paining. They get a back pain if I press here.
Okay.
So because all this nervous system is connected, but mostly the back of the head and front of the head having a different nerve supply, still they are interconnected. So someone starts having headache from the back, but then it starts coming on the front, even in the eyes, on the face, in the nose. I had a patient whose headache would start from nose, from inside the nose, from one side. So these are very intricate things which many people do not know, and because of these interactions the headache spread we can explain. Now if I can say that there are certain tissue bands which are present on these nerves origin, so when the nerve is squeezed it is going to create a pain, and then it creates so much pain it spreads everywhere, and then when it causes pain. So it was a trigger point at one place, but now it is causing spread all over. So we have to know from where the trigger is. I'll give you another example. Like someone has got, there are some fine nerves which go from here, from between the muscle sheets. There are different sheets of muscles.
Okay.
They are supposed to go from between the sheets of muscle. But when they start piercing the muscle and they go, now if you are tense and the muscle got tense, because facial muscles and head muscles, they get tense when you are stressed. When the muscles are tense, then they squeeze the nerves, they compress the nerves, and headache starts. So that's how from stress headache starts. Okay, and then it spreads to everywhere. So these are the things which cause headache. These are called the trigger points, and for these very well documented work on surgeries and releasing these nerves is there, which usually we should not show the graphics, but like these kind of endoscopies can be done, which we call as migraine surgeries. But before that we start with the trigger points, and we see. I had one patient who came to me and had headache only in one particular area, and he jokingly told me that you just cut the nerve of this area and then so that I can be happy. And we started researching on that, and we found that there are at least 8 cases reported in the world, and so it's extremely rare condition, but we operated him, and when we operated him, we got almost 80-90% immediately relieved. And these are like daycare surgeries with very minor cuts, and because the nerves are very, very thin, they're like threads. So there are these are the actual surgery pictures, which I don't want to show too much.
Yes.
So in short, you can see that there are, just if you follow my pointer, that you would find that there are yellow is the nerve and red is the blood vessel. So there are different types of interactions between blood vessel and the nerve, which can cause throbbing headaches if they are pulsating and hitting on the nerve, or like they are thumping a nerve, and then the nerve gets sensitized, and then now you get a throbbing headache. You know, many people tell us that there is throbbing headache. My headache pulsates with the heart. That's a throbbing headache, because the blood vessel will have pulsation equal to heart rate.
Some people have a tendency, they say that if I've not taken tea or coffee, I receive headache. How does that apply with our systems?
So these are poorly understood mechanisms. Many of the people, yes, caffeine and tannin, because tea has got more tannin, coffee has got more caffeine, although both have both. Okay, coffee has caffeine and tannin as well, but predominantly caffeine. So if you have made yourself dependent on certain things, now the deficiency of it, which can cause headache, is the way you look at things. Many people, even for me, it was like, if you're not taken a tea in the morning, then you will get headache or you will feel weakness. But then gradually I started a morning routine where I don't want to eat anything in the first 2 hours after waking up, and only do exercises. That's when I just left the tea in just 1 month.
Mentioning that, maybe that's a tip on how to manage this headache thing. Maybe what are the other tips that one can use in order for him or her to manage headache?
Now, beyond a point, headache cannot be managed at home. Okay, one of the things which I found serendipitously is that I would like that our presentation we show continuously, because I would keep referring to those things. So please show the presentation along with me.
They're going to keep.
So once I was on a very long journey, and I got a severe headache. When I reached there, I was sleep depleted and I was very tired, exhausted, and I had severe pain on my back. When I had migraine. So when I went there, I found tea. Usually you go in a hotel and you find a tea bags. So there was one English breakfast, and there was a chamomile tea. And when I tried the chamomile tea, because I'd never tried, but within 15 minutes my headache was gone. This is one of the cheapest treatment I have found. So sometimes chamomile tea can work, but if you have established trigger point, it will give you chronic headaches, and chronic headache means we are saying that you have got headaches more than 3 months, and then we call it severely disabling headaches when more than 2 days a week you don't want to go. Even if you're going, you actually did not want to go to work, or you didn't want to perform duties at your home. You wish that I just slept. So those things. So then they need intervention and the more chronic you make it, the more spread will happen in the nervous system, and it will be more difficult to control.
Okay, mentioning about the tea that you had, you know, sometimes it comes with the lifestyle. How does lifestyle affect or it contributes a lot into this type of illness?
If you are sitting idle, if you are lying idle, if you are not doing exercises, if you are getting up late, if you are, if you're keeping late hours in general, then definitely these are the predisposing factors for headache.
Okay.
For me, if I'm getting later than 2 a.m., I know for sure 100% I'll have headache the next day. But when I start getting up at 4:30 or 5 a.m., I found that there's no headache. But at the same time, it's not necessary, because I have seen so many people who are early risers, but they had headaches, because you cannot rule out the organic cause of headache, where a real nerve is being compressed by either a blood vessel or a tissue band. So we have to see that there can be some physiological causes, but there can be some anatomical causes, where anatomy is bad. It is something which is compressing a nerve. If anatomy is bad, then you have to do some intervention. That's why we call it interventional headache management.
Okay.
Yeah.
And Doctor, you've mentioned something about sleeping pattern. Maybe what is the right way for someone to have a good sleeping pattern that cannot affect you or cause you to have this type of illness?
No, in general, if you are disciplined about your sleeping habits, if you are sleeping early, well within time, maybe 10 a.m., 10:30, 11 a.m., and getting about 5:30, doing some morning exercises, doing some yoga, performing some breathing exercises, very high chance you will get very, very less headaches.
Less headache. Yeah. And who are these people who are prone to these type of migraine? Is there a specific age group, people that we say that they are prone to these type of illness?
No, we are finding headaches starting from as young as 4 or 5 years, when before that children are not able to speak or express properly. But we have headaches. Pediatric headache is also very common. Because if there is some anatomy which is wrong,
yes,
there are a lot of things which happen. Some people get a head injury, and after that even a minor head injury.
yes.
I had a child who during childhood, when she used to go to some educational institution, her head was banged against the wall few times, and then she developed headache for 19 years, and it was not getting corrected at all. And then we did intervention, and she got all right only in the first sitting.
Okay.
So if I can refer to the diagrams that I wanted to show.
Yes, as my producer is yes, it's there.
Yeah. So this is the back of the head, where there are very specific sites where the nerves are.
Yes.
And we can block these nerves to begin with, because and I would like that both of us are shown on the, I mean both means my presentation and me, if they are shown on the TV.
Yes.
Then so we have patients where we do these blocks, and then these blocks do wonders, because mostly we wanted to move very fast on nerve surgeries,
yes,
on migraine surgeries.
Yes.
But we found that if you're doing blocks at these sites, then patients are very happy even for 6 months, 9 months. I have an example of more than 1 year. I had a young girl, who's just in grade 9, had to travel into an international school competition in University of Yale, and no one was able to treat her, so we gave her an injection block last year September, and now it is December and she is still fine.
Okay.
So just one set of injection and it was gone. So these are the actual surgery pictures where there are tissue bands which are compressing the nerve, which we can relieve. So classically there are some people who do Botox injections.
Yes.
Now mind, if you do Botox injections more than twice, the skin under the muscle under the skin can get paralyzed.
Okay.
So you can see several celebrities who got these Botox injections to get rid of these small wrinkles,
yes,
but their face becomes funny, it looks puffy, it looks strange, because they have lost the expression, micro expressions.
Okay,
so
and Dr. I'm being told that time is not on our side, and I think the last thing that we can tackle before we clear this, you as Nairobi Neurocare, what are some of the new mechanism and treatments that you have?
What we are discussing is very, very new.
Yes.
Practically no one is doing in India, practically no one is doing here. Some people are doing Botox injections, which I don't think should be given. We are very costly. They are not long standing. You're not causing you're not treating the cause. So the best thing is that we do intervention in a certain way that is long lasting, and we have found a way where we are finding the patients the long lasting results. So this is very unique to Nairobi Neurocare.
Yes.
This is what we are doing for last 1.5 years. More than 150 happy patients we have. Because of privacy issues, I don't want to show their videos, but they are there in the same presentation. But we have several happy patients.
So in case for anyone who wants the same treatment, it is best you go and visit Nairobi Neurocare, where you will get best treatment out of those people who have spoke about it and mentioning that they treat well, mashallah, and that's good. And thank you so much for staying with Horizon TV. I think at this point I don't have much to add or to reduce. At this point I'll leave it there. Till next time, on Tuesday, same spot, same place at Horizon TV. Keep tuned at Horizon TV. This program was brought to you by Nairobi Neurocare. It is Stay Healthy. My name is Abdulrahman Gaddafi, and our doctor is Dr. Mahendra S. Chouhan. Till next time, next Tuesday. Assalamu alaikum wa rahmatullahi wa barakatuh. Have a good day.
Horizon TV, the beacon for the nation.